I'm Jill Moffat and I care for my son John, who's 32 and has Down syndrome. My husband also had multiple sclerosis. As John got older, my husband's condition got worse, so the caring changed. So I was caring more for one than the other. John went to mainstream school, and that was always very difficult because it was early days of children with Down syndrome going to mainstream school, so there was a lot more challenges. We also got respite for him very early on. It was family-based, where he went to a family. It started off just for an afternoon, and then it progressed as the years went on that he would go for the weekend, and that was really quite good. That went on until he was about 15, when it was John's choice to stop. So now we've settled into a routine where he, has different activities every day, but that involves me taking to all of them apart from one of them. And so I'm a glorified taxi driver, and my day is filled with leaving him off and picking him up, and etc. So he loves anything to do with drama or musicals or dancing. So one of the things he does, he's with the Now group, and he does a drama group with that, and he loves it. Wednesday he goes to Larch Village and does gardening and other activities there. Thursday he goes to Caring Breaks, which is one of his favourite things to do. And then there's another group he goes to once a month on a Friday, which is called the MAC Club. MAC stands for Making Adult Choices, and it's a disco in Beach Lawn Hotel in Dunmurray, which loads of people go to, and he absolutely loves that. Making adult choices is that he can have a drink if he wants, and unfortunately on the odd occasion he's had too many, but that's his adult choice. So he has a busy week. Everything I do, I always have to think of what he's doing first. My life comes second. John was often sick all the time. I mean, 1 minute things would be going along lovely, and the next minute he'd be in hospital for 10 days. And, I always stayed with him while he was in hospital, so I would keep disappearing from my poor daughter. Luckily, she's turned back okay, thank goodness. But it was a lot for her as well to deal with all of, to grow up with that. I didn't get married until I was 30 or have a child till I was 31. And I was very career orientated. And then when he was born, he was my big concern. So I was very lucky in that I was one of the first nurses to job share with another nurse in the Belfast Trust then. So that worked well. And then I eventually got a part-time job as a research nurse, and that was very flexible, and I could pick my own hours. So I was very lucky in my work, whereas a lot of other people aren't. I was just lucky, and that's how we managed. And my mother was an absolute godsend. Couldn't have done without my mum. It has been very challenging at times. I've suffered a lot with my mental health over the years, and I've had some good experiences with help with that, and some very bad experiences with help with that. But support from friends and family have also helped. Yeah, I feel definitely if it's your child, you don't look at yourself as a carer. And I didn't identify being a carer with my husband because he's my husband. That was just something you did. It wasn't until much sort of later. And years ago, it wasn't a thing to be a carer. It's only, I think, more recently it's much more identified. My husband went into a nursing home because we were caring for him, at home. His cognition was very poor. His personality changed. Say the occupational health person came in and said, can you make yourself a cup of tea or get yourself something to eat? Oh, yes, I can. He couldn't. But I can't. I would say, no, he can't. And he would go, yes, I can. And they would write, yeah, he could. And I'm going, but he can't. And they were taking his words over mine. He was going in for respite care once every 3 or 4 months for a week or two at a time. And eventually, at one stage, a social worker phoned me up and said that he wouldn't be going into my husband wouldn't go into respite anymore because he didn't want to be there and it was against his human rights. And as a result of that, I had a breakdown. He went into a nursing home as an emergency and my mental health was so bad I didn't see him for 5 months. And if it wasn't for my sister, who paid for me to see a psychiatrist privately every week, I would never probably have come out of that because I didn't get any offer of help from, GP or health service or anything. It's sad the way it happened. It was maybe against his human rights, but then I have human rights and my children had human rights as well. It took several years and a lot of fighting and eventually a complaint to the trust for him to be diagnosed as having no mental capacity. And it took a lot of work from a very, very good neuropsychologist. But it was due to me complaining and going on all the time. And there's so many people maybe just with not as much forcefulness as me, or me knowing the health system, from working in it and stuff, that would just maybe give up. Anything that I have got, or of any group that I've got in contact with, it's been from word of mouth from other carers. There's been maybe 1 or 2 things that social services have brought to my attention, but all of the rest is through word of mouth, through other carers. My husband passed away in October last year, and it was only after that I found, actually, even though he was in the nursing home, but I just found I've got more time and I'm going to do something for myself. And I joined the Down syndrome choir with my son. It's the only thing he lets me go to with him. And I was enjoying the singing, and then saw about the carers choir, so I joined it. And I'm absolutely loving it, it's just really, really good. And the girl that runs it is just amazing and uplifting and super. I think it's just knowing that other people are going through the same thing, and you don't have to talk about it with everybody else. You just know, oh, they're caring, and they're probably having a more difficult time than I am, but we're all here singing together, and and that's good. Actually, my daughter found that years ago, whenever she was a teenager, she was part of a young carers group, and she loved it because she said it was, you went along and you knew everybody else there. Nobody talked about who they were caring for, what they're doing, but you knew everybody else there was caring for somebody, and there was no judgment. Whereas in school, she had people teasing her and, being not understanding. Even teachers not understanding of her caring role. So, I think it's important for young carers to have that support as well as us older ones.